Let me begin with a question almost every man has thought about, but very few ever say out loud, especially men over 50. What actually happens if you ejaculate every single day? Is it good for your health? Can it improve your energy, sleep, mood, or sexual performance? Or on the other hand, can it quietly exhaust you, lower your desire, or create performance issues as you get older? If you've wondered about this, you're not alone. I hear this question from many older male patients, men who silently worry about sexual health, testosterone, and whether their habits are helping or harming their bodies. Many of them grew up in a time when sex education barely existed, where talking about self-stimulation or ejaculation frequency was almost taboo. So they carried this uncertainty for decades without knowing who to ask. I'm Dr. Emily Carter, a urologist with over 14 years of experience working with men from their 30 seconds all the way to their 80 seconds. And there's one thing I've seen clearly. Sexual health doesn't fade just because you age. In fact, it becomes even more important because it affects your heart, hormones, sleep quality, mood, confidence, and even longevity. In this video, I'm going to help you understand the full science behind daily ejaculation, the benefits, the risks, and most importantly, how to figure out the frequency that works best for your body after 50. And before we go any further, leave a comment and tell me where you're watching from. I love seeing men over 50 from all around the world sharing the same conversation. And if you care about men's health topics, don't forget to like and subscribe. It truly helps spread this important information to more people. Before we dive deeper into the benefits and drawbacks, we need to understand one crucial truth. There is no single answer for all men. Ejaculating every day isn't automatically good, and it isn't automatically bad. The real question isn't every day, or not, it's how your body responds. Some men, especially those dealing with stress, mild insomnia, or anxiety, actually feel better when they have regular release. They sleep deeper, feel calmer, have fewer muscle tensions, and are less irritable. And this has a very real biological basis. During ejaculation, your body releases a series of hormones that calm the nervous system. But other men, especially those who feel physically weaker, low on energy, or are going through hormonal changes after 50, may feel drained if they do it too often. They feel tired, less interested, and sometimes physically slower or less energetic. And remember, this says nothing about your masculinity. It simply reflects how your nervous system, hormones, and energy levels respond to that frequency. So if you've ever felt confused about whether doing it every day is good or bad, the reason is simple. Every man's body is different, and no one ever taught you how to listen to your own physiological signals. When we talk about daily ejaculation, one of the clearest benefits lies in how the brain responds after each orgasm. Younger men experience this too, but men over 50 feel it more deeply, more noticeably, and with longer-lasting effects. Right after ejaculation, your body releases a series of important hormones. Endorphins relax your muscles, ease tension, and reduce fatigue. Dopamine boosts motivation, positivity, and overall satisfaction. Oxytocin reduces loneliness and creates a sense of connection and emotional safety. Serotonin stabilizes mood and helps keep your emotions steady. For men over 50, these hormones don't just create pleasure. They help rebalance the nervous system, which becomes more sensitive to stress with age. After 50, your body naturally produces less testosterone and tends to release more cortisol, the stress hormone. This makes you more prone to irritability, anxiety, and mental restlessness. Many of my patients describe the feeling after ejaculation as a natural pressure release valve. A 61-year-old man once told me, "Doctor, I don't do it for pleasure. I do it because afterward, my mind becomes incredibly calm." The science behind this is simple. Endorphins plus oxytocin equals reduced activity in the amygdala, the part of your brain that handles stress responses. When the amygdala calms down, you often feel less anxious, less tension in your neck and shoulders, more patience, more open, social, and relaxed. For men between 50 and 70, an age when stress, responsibilities, and health concerns pile up, this mental reset effect is a very real and meaningful benefit. One of the clearest benefits older men report to me is this: they sleep better after ejaculation. And it's not because they're tired out, it's a real biological reaction with solid scientific explanation. After orgasm, your body releases prolactin, a hormone strongly linked to sleepiness, deep relaxation, and the urge to rest. This is why many men feel their eyelids grow heavy right after they're done. Not only that, this process also helps lower cortisol, the stress hormone that tends to rise in older men, especially at night. High cortisol is the reason you struggle to fall asleep, sleep lightly, wake up at 2 or 3 a.m., lie in bed overthinking. When cortisol goes down and prolactin goes up, your nervous system shifts into what we call a rest and recover mode, a deep restoration state. This helps you fall asleep faster, stay asleep longer, wake up fewer times during the night, get up feeling refreshed. One of my 8-year-old patients told me, "I couldn't sleep for an entire year, but strangely, every time I release, I sleep like I'm 20 again." And here is the important part: good sleep is the foundation of long-term health. It affects your memory, blood pressure, heart health, weight, mood, immune function. So if ejaculation helps you sleep better, that is a completely valid and meaningful benefit, especially after age 50. The next benefit is directly related to blood circulation. And this is actually the most important factor determining erectile quality in men over 50. Many people think erections are a testosterone issue, but in reality, erections are a vascular response. When you're aroused, blood vessels in the penis dilate, allowing blood to flow in and stay trapped. If your vascular system is healthy, you get firm erections. If it's weakened, you may experience slow erections, weak firmness, losing the erection halfway, or erections that fade quickly. And this is something regular ejaculation can help improve in older men. When you reach orgasm, your heart rate goes up, your blood vessels expand, and blood circulates more strongly throughout the body, including the pelvic region and penis. This works like a mini cardio workout, helping maintain the flexibility of your blood vessels. If you don't use it, you lose it. Use it consistently, and it stays healthy. Just like muscles weaken when they aren't exercised, the vascular system of the penis can weaken when it isn't regularly activated. Many men over 50 tell me they gradually lose their natural sexual reflexes when they go too long without sexual activity or self-stimulation. That's not just aging, it's the lack of pelvic blood flow stimulation. Ejaculation also boosts the production of nitric oxide, the chemical that opens blood vessels, and is the key mechanism behind erections. This is the same pathway that erectile medications rely on. So for many older men, regular ejaculation at whatever frequency works for them can help maintain healthy blood flow, strengthen erectile reflexes, support pelvic vascular health, improve confidence and sexual performance. This is not a bonus benefit. This is a core part of men's health after 50. One of the most surprising findings, and one of the main reasons many men care about regular ejaculation, is its relationship with prostate health. The prostate is a small but incredibly important gland located just beneath the bladder. It produces the fluid that nourishes and transports sperm. But as men age, the prostate becomes more prone to inflammation, enlargement, urinary difficulty, nighttime urination, pelvic heaviness or discomfort, and more importantly, prostate cancer risk increases with age. Now here's the interesting part. A large Harvard study following more than 30,000 men over nearly 20 years found that men who ejaculated 21 times a month or more had significantly lower prostate cancer risk compared to those who ejaculated less frequently. Why? One widely accepted theory is that ejaculation helps flush out the prostate by removing old or damaged cells, clearing inflammatory substances, reducing buildup of harmful compounds, maintaining a healthier internal environment. You can imagine the prostate as a small tank. If it's not emptied regularly, Old fluids can accumulate and create a favorable environment for inflammation or abnormal cell changes. Regular ejaculation helps replace the water in that tank. It also improves blood circulation into the prostate region, which may reduce mild swelling, inflammation, and help maintain long-term prostate function. However, it's important to emphasize one thing. Ejaculation frequency does not replace PSA tests or routine urology checkups, but it can be a meaningful supportive factor in prostate care after age 50. For many older men, this benefit alone makes them think seriously about maintaining a healthy, consistent frequency. The fifth benefit of regular ejaculation, and one most men over 50 hardly ever think about, is its positive effect on the immune system. Multiple studies show that right after orgasm, the body increases the production of immunoglobulin A, IgA, an antibody that serves as the first protective barrier against bacteria and viruses. IgA defends the respiratory tract, digestive tract, and other mucosal surfaces from infection. For younger men, this might seem like a small benefit, but for men over 50, when the immune system naturally weakens, this increase in IgA, combined with the stress reduction after orgasm, becomes much more valuable. Chronic stress weakens the immune system, making you tire easily, catch colds more often, and recover more slowly. But when your body relaxes thanks to dopamine and oxytocin, your immune system gets a chance to stand back up again. Many of my patients in their 60 seconds and 70 seconds tell me they experience fewer minor illnesses during periods when they maintain regular sexual activity and feel mentally relaxed. Of course, ejaculation isn't a magical immunity booster, but it is one link in a larger biological chain that protects your body, especially in older men. And I want to ask you something. Have you noticed your immunity changing based on your sexual frequency? Do you ever feel more tired, more stressed, or more prone to getting sick and think it might be related? Share your experience in the comments. Your story might help another man realize he's not alone. Up to this point, we've talked about 5 very real benefits that regular ejaculation can offer men over 50. A calmer mind, better sleep, stronger circulation, improved prostate health, and better immune function. All of these are backed by science, and for many men, regular ejaculation is a natural part of a healthy lifestyle. But, and this is important, more is not always better, just like exercising. Doing it regularly is good, doing it too much leads to injury. The same is true for the biological reactions involved in ejaculation. When it's done too frequently or for unhealthy reasons, those benefits can flip into drawbacks. Many of my patients tell me, "Doctor, at first it felt great, but then I started feeling tired and less interested." That's when we need to take a more serious look at what's appropriate for your body, rather than chasing a number or repeating a habit. And here is the key point. The harm from daily ejaculation doesn't come from the activity itself. It comes from how you use it. If it comes from choice, you benefit. If it comes from impulse or emotional compensation, you may run into problems. Drawback. Number 1. Compulsive behavior. The first and most silent downside happens when ejaculation stops being a choice and slowly turns into a compulsive behavior. This is something many older men don't realize because it builds gradually, disguised as a harmless habit. Compulsion here doesn't mean addiction in the negative sense people often assume. It's a form of dopamine dependence when your brain unconsciously seeks quick release to reduce stress, boredom, loneliness, or emotional emptiness. Some signs that ejaculation is becoming compulsive include feeling restless or uncomfortable if you don't do it, waiting for the right moment just so you can release, difficulty focusing until you get it out of the way, using it as an escape from negative emotions, hiding the habit, realizing it takes more time than before. When these signs appear, the issue is not daily versus, not daily, it's the relationship between you and the behavior. Older men are more vulnerable to this loop. Why? Because many face loneliness after children move out, financial pressure or retirement stress, long-term mental fatigue, worries about aging and health, loss of emotional connection, fewer social activities. The brain becomes more likely to cling to quick relief behaviors as a form of self-protection. But the problem is, this quick relief does not solve the root issue, and when you rely on it too much, it can drain your overall energy, make you feel out of control, weaken your confidence, reduce desire during intimacy with a partner, create guilt or emotional fatigue. These are the clearest signs that it's time to reevaluate your frequency and the emotional reasons behind your habit. Drawback. Number 2. Using ejaculation as an emotional escape. The second drawback appears when ejaculation is used as an emotional escape rather than a natural physical need. After age 50, many men face loneliness, financial stress, family pressure, or a growing sense of losing control. Ejaculation provides instant relief through dopamine and oxytocin, so the brain quickly learns that this is the fastest way to soothe uncomfortable emotions. The danger is that this pleasant feeling only covers the problem temporarily. It does not solve the root cause. Over time, relying on ejaculation to suppress emotions can lead to difficulty facing real stress, reduced emotional connection with your partner, the feeling of emptiness returning more quickly, an increasing need for release to feel calm. Some patients admit that they don't do it out of desire, but because if I don't, my mind becomes unsettled. This is not wrong or shameful. It's simply a sign that your body needs additional healthy coping tools such as exercise, conversation, meditation, or social connection, rather than depending on just one habit. Drawback. Number 3. Lower fertility if you're trying to conceive. Not all men over 50 are still planning to have children, but if you are, daily ejaculation can affect your fertility. Sperm requires about 48-72 hours to regenerate. When ejaculations are too close together, sperm count drops, sperm density decreases, fewer healthy sperm are produced. This doesn't harm your health, it simply means your body doesn't have enough time to restock. Many men are surprised when their semen analysis shows low numbers, without realizing the cause is frequent ejaculation. Once they adjust their frequency, for example, once every 2-3 days, their results often improve significantly. What you should remember is, this is not a disease. It has nothing to do with testosterone. It does not cause long-term problems. It is simply a practical strategy if you're trying to conceive. Drawback. Number 4. Reduced sensitivity and lower natural desire. When ejaculation happens too frequently, especially over long periods, your brain's dopamine receptors begin to lose sensitivity. This makes it harder to feel aroused or excited the way you used to. This is called dopamine downregulation. As a result, natural desire decreases. You need stronger stimulation to feel the same pleasure. Climax feels less intense. Excitement with a partner becomes weaker. Repeated self-stimulation, in the same pattern, can also create a fixed reflex, training your body to respond only to one specific type of stimulation. So when you're with your partner, the response feels much weaker than expected. The important thing is, reduced sensitivity is not permanent. Taking a break for a few days or changing your stimulation pattern can help the dopamine system recover quickly. The clearest sign of this issue is, your body still works perfectly fine, but your excitement feels lower. The last drawback many men over 50 experience but rarely talk about is the development of a quick-release reflex when ejaculation happens too frequently, especially when the habit is fast, rushed, or follows the same stimulation pattern. The male brain learns incredibly fast. If you repeat the same type of stimulation long enough, your body automatically memorizes it and sets that pace as the default. When this happens, you climax more quickly with your partner. Your body struggles to maintain a slower rhythm. Anxiety or performance tension appears during intimacy. Overall performance decreases. Confidence takes a hit. This has nothing to do with confidence, age, or erectile weakness. It's simply a neuromuscular habit you've unintentionally programmed into your body. Many men assume the issue is aging or poor health, when in reality they're experiencing a reflex created by repeating the same fast stimulation too many times. The good news is, this reflex can be reversed. All you need to do is reduce frequency for a while, slow down during self-stimulation, Maintain deep, steady breathing. Focus on slower, manual stimulation instead of fast, hard, constant. Practice edging, delaying climax, intentionally. After a few weeks, most men notice significant improvements in control and timing. This issue isn't dangerous, but it directly affects intimacy, emotional connection, and confidence, especially after 50, when every intimate moment becomes more meaningful. So what is the right frequency? There is no universal number for all men. The ideal frequency is the one that helps you feel good, sleep well, stay emotionally balanced, maintain strong energy, not the one that leaves you tired, uninterested, or emotionally dependent. The best approach is to try a 1-week experiment. A few days with no ejaculation, a few days with daily ejaculation, a few days with slow, mindful stimulation. Your body will give you the clearest answer through your energy, sleep, emotions, and natural desire. When to see a doctor immediately. If you experience any of the following, get checked soon. These are not normal age-related changes. Pain during ejaculation, pelvic or testicular pain, blood in semen, sudden erectile weakness, difficulty urinating, burning, or rapid increase in nighttime urination, heaviness or pressure in the prostate area. These symptoms can be linked to prostatitis, hormonal issues, or vascular problems, and early detection always leads to better outcomes. So, is daily ejaculation good or bad? It isn't inherently good or bad. The most important thing is to listen to your body. If daily ejaculation helps you sleep better, feel calmer, and maintain strong sexual health, then it may be right for you. But if it makes you tired, lowers your desire, or becomes an emotional escape you rely on, then it's time to adjust. Now I have one simple question for you. If you found this video helpful, comment 1. If you feel it doesn't match your experience, comment 0. And don't forget to like and subscribe for more men's health content after 50.